I'm Ben Ryman, and this is Behavior Speak. In this conversation, Arthur Hairston discusses the complexities of the foster care system, focusing on the challenges of educational rights, the importance of family reunification, and the dynamics of long-term healthcare placements. He highlights the difficulties faced by children in care, particularly regarding their educational needs and the legal rights of their parents. Arthur also emphasizes the significance of staff retention and the positive organizational culture he fosters at his group home, as well as the cultural differences and basic needs of the children they serve. He includes with insights into future plans for expanding services and community impact. All right, welcome, Arthur.
Hey Ben, how you doing?
Doing great. How about you, man?
I'm doing great. It's nice and somewhat sunny here in Florida, just cold.
Yeah. What's cold for you? What's the temperature?
I think right now it's like 58.
Yeah, I think if I'm in Canada, we're in Celsius, so I think if I do the conversion, I think it's 33 here. Yeah. So you don't know cold.
No, I used to.
Yeah. And actually, it's not that bad. All right, just before we get started, I always like to acknowledge I'm producing this podcast on the lands of the Klehus, Homoko, Comox, the Kla'amin First Nations, and I'm grateful to be here. So maybe we can start, Arthur, by just telling us a little bit about yourself. Who are you? Who's Arthur Hairston?
Let's see here. I'm a husband, father, son. For me, just a passionate person who's passionate about helping others is who I am in any way that I can. So I find myself in the disability services realm currently.
How'd you get into sort of the realm of disability?
I would say it would go back to growing up. Maybe my mother was a principal and she was also a special education teacher. So I just remember doing Special Olympics back in high school, helping out at one of her schools. And from there, I ended up undergrad special education. I was trying to avoid it, but some kind of way I fell into it. Masters, the same thing as well. I don't know about going back for a doctorate, but just kind of just keep learning about all these services, going through school and just volunteering. You just learn so much, and just get passionate at hearing the need out there.
Wow. So following in your mom's footsteps.
Yes.
Is she pretty proud?
Yeah, she is. Yeah, she's actually the reason why I used to want to be a principal, and the reason I always thought I'd go back to school for like educational leadership. And I remember my mom saying she wanted to teach when she retired at a community college, but they would not accept her because her master's was not in a subject area.
Hmm.
Well, I kind of learned that, oh, you can, get a master's in special education and then just add on something to your teaching certificate like educational leadership, but that opens up the door if I ever wanted to, which I have taught, at the collegiate level. So I'm just thankful that I learned that lesson
Yeah.
early.
Yeah, absolutely. So what were some of kind of your early experiences in the field? You talked about doing a lot of volunteering, but so tell me a little bit about that.
Yeah, so I would think professionally, I would think back to college, just with the major being in special education, there's so many projects you have, but also when I was looking for a job in college. I don't even know if the terms ABA, you would even find that where I was in school in North Carolina at the time.
Sure.
But there are some things listed that kind of sounded like what I'm already doing now within ABA, but it was more so just working with the kid one on one,
Hmm.
helping reduce, behaviors, taking them into the public, going on outings and assisting them. So that was just one, summer job there. Well, not summer job, but just a job in school that I did, a couple hours. And from there, just graduating and then teaching, being a teacher as a special education teacher in Florida. That's when I kind of, did it professionally teaching. And actually, my first summer job, because, teachers, they don't get paid that well. So
Hmm.
it helps to have a summer job.
Yeah.
So my first summer job after teaching that first year was actually at a clinic. It was an ABA clinic, surprisingly.
Hmm,
And I had no idea what I was doing or that it
hmm,
was an ABA clinic. I just remember going there thinking, how's this place open? It's only, it might have been 20 or 30 people, but I'm like, how's this place open? And
hmm,
you don't really have anybody. Didn't know anything about insurance at
hmm.
all. I was just there working. I wasn't making much at all, but I kind of learned later on what I was doing. And I was like, wow, I found myself, in the same thing that I was doing first summer job, being back in that field of ABA.
So in that summer job, were you sort of, and maybe didn't realize it, kind of doing the kind of the work of an RBT or something different?
I was doing the work of an RBT. Surprisingly, I remember the kiddo that I was working with was just there for the summer. So the other
Hmm,
kids, I think, they had a school as well, and all the other kids were there. And I remember them saying, well, insurance helps pay for them, but this kid's just here for the summer. This is just private pay. And
hmm,
I didn't know, what was going on. I just remember doing DTT a lot with the
hmm.
kids,
Right.
and I did a lot of DTT, which I
Hmm,
think might be why I'm not the biggest fan of it being traditionally done at a table.
hmm, hmm.
But it was I was learning. I didn't even know. It was just pretty cool to see the power of reinforcement and just seeing how quickly they were just learning. But also it showed me that I really need to be out in the community.
Hmm.
Clinics weren't my most favorite thing to be just because I like to be out in the
Yeah,
public doing stuff.
I get that. Yeah. And just for sort of context for folks that might not be familiar with the field, so DTT, we're talking about discrete trial training, which is kind of and you're talking about sort of the sort of traditional kind of at the table. And so for some context, and again, I didn't do any of that work kind of in my career. And so I just sort of know this from others, but essentially the picture is probably what you think of it. You've got a child sitting at a table, an adult probably sitting across from them, and kind of repetitively going through, different trials of discrete trials, individual trials of teaching some task or some learning item or goal or whatever, probably somewhat repetitively, um, providing some level of minimal or short duration kind of reinforcement, whether that be in the form of an edible or access to some activity or and so on and so forth, sort of
Yeah.
over time. And what were your struggles that like before we get into that? When are we talking here? So what year is this?
This was summer of 2014. I was doing
Okay.
that, and I had started my master's program as well that summer. So I was getting my master's in special education. So it kind of helped to be in that environment during the summer because I actually was taking a course, and the professor was a board certified behavior analyst that did not really tell us what he did. He just always kept saying maybe you'll join the dark side one day, which I didn't understand and
Hmm.
I didn't get it. I just knew, hey, I'm getting this master's because I need to have a subject level, but I'm going to be a principal. So I'm
Hmm.
just taking this, and eventually my goal is, being the principal. But It was so helpful to, be in school and also doing, that summer job, keep me motivated. So that was wow. In 2014, I did that, and then I went back to teaching.
Hmm.
That fall, school started back up. ABA, I still did not really know what ABA was. I don't think I found out what ABA really was until 20 2016,
Hmm.
October
Hmm.
2016. I can remember like it was yesterday. I was at a
Hmm.
friend's house, and I remember his girlfriend at the time was in school for getting a master's in applied behavior analysis. And I just remember telling her some of the frustrations that I was having, like, well, when I was a teacher, kids looked at me one way. But now that I was a dean of students, and kids were kind of looking at me differently at that time. It wasn't, I wasn't the same cool, Mr. Arthur anymore.
Hmm.
It just seemed like I just wrote referrals is what people kind of looked at me
Hmm.
at, even though I try to put in interventions to help the teachers and to help the students
Hmm.
stay out of the office. And she was like, you know what? You might want to be a BCBA. And I'm like, what's that? And she tells me, board certified behavior analyst. And I'm just asking more questions. And I said, sounds kind of familiar. I feel like I've heard that. And I
Hmm.
did hear it one time back in 2014. I was like, and she started describing it. And I was like, wow. I said, I had no idea. So I'm just really into it. I'm like, I think I want to do this. And this is October, and I am closer to probably being a principal. I just need to, pass this exam, add it onto
Hmm.
my teaching certificate. I actually took it once already, and I only passed. There's three parts here in Florida, and I passed the written part, but the other parts I was like, I need to, study a little bit more. But I was studying at the time to retake that test, but she told me
To
about
be a
this.
principal.
Yeah, to be a principal. That's what my goal was. I want to be a principal, so I need to do this. And once she told me that, I thought about it. Funny enough, the first place I worked, I think the clinical director at the time, and everybody probably knows him if you listen to this, Shane Spiker. I remember
Hmm.
he came to my job. I was
Love Shane.
a dean at a school out at the beach, Jacksonville. And I remember him asking, he came out there, he was like, how are they with tattoos? I'm like, it's cool. I said, we're at the beach. I said, our parents, come in sometimes they're coming from surfing or maybe they got a sun bath, so you see a lot of interesting things from some parents that come in. I'm like, that's it's nothing. Come on in. So he comes in, and it's first time meeting him, super cool. And I was telling him about what I was doing because I needed a supervisor for, towards hours because I kind of already had a plan in my head of where I was going to go for school. I need to take six additional courses, X amount of hours. And I thought I was going to be able to stay there, talking, say, hey, yeah, we can just, have the supervisor come and, all this stuff you're doing that's behavior analytical. I said, we can count this towards your hours. So I'm thinking, this is going to be perfect. I'm going to be, doing these interventions, applying, ABA into the school and trying to find a supervisor at the time was very difficult, and I didn't know anything about remote supervision.
Hmm.
That wasn't in my vocabulary. Was never mentioned to me. So I'm like, man, this is really going to work. If I really want to make sure I know what's going on, I'm going to have to leave here. Which is kind of scary. I mean, I've been teaching, and to think, okay, I'm going to leave and I'm going to go work someplace else. And there was this place I applied to online and I got the job. And I remember putting in my I love where I was. I mean, who could hate working at the beach? Like literally I'd go to the beach before I went to the school, make some good connections as well too with like the surfing people because
Hmm.
it helps make connections like that because some of our kids like to skip and I like to
Hmm.
know if the waves what they're looking like because I know who's not going to be there on time.
If the
So just to
waves are
have
high, the kids are gone.
Yeah, it was just it was a lot. It's like it's a culture that I had gotten used to, and I'm like, okay, I'm about to switch and go into a clinic, which
Do you have a credential with the International Behavior Analysis Organization, the Qualified Applied Behavior Analysis Credentialing Board, the Behavior Analyst Certification Board, or would like a certificate of attendance for another organization?
I didn't know what that was going to be like. And I
Hmm.
remember leaving, telling my principal, and she said, "Well, you sure this is what you want to do? Go for it." So I left. Actually tried to talk myself out of it. I just remember sitting there like, do I really want to do this? And like actually leave for this job. And I didn't think teachers got paid that well. And then I went to go work at a clinic thinking, oh, because I have a master's, that there's some differential. Insurance doesn't recognize, you have a master's, so we're going to give you a little bit more. I took a very reduced amount of money. Luckily, even insurance, I don't even think I had insurance. I had to get a separate policy, but I was fortunate I was married. So luckily, my wife definitely made more than me at the time. So that helped out a lot to be able to even think about taking a reduction in pay. So I remember going to work at the clinic. At the same time, I'm also working with another company, going in-home services.
Hmm.
In-home did not work out for me at first. I was getting a lot of clients. I remember here in Florida, if a child is in crisis mode, or even adults, they have this thing called the Baker Act, where you can be placed on a up to a 72-hour hold in a psychiatric hospital or a place that deals with mental health if
Hmm.
you're, in danger of hurting yourself. So I just remember the first couple of clients I had, that was a constant thing for them. Like they would be on Baker Acts. It was needed because they would self-harm. But in this field, if you don't work, you don't get paid. There's no, "Oh, well, we'll just pay you because this is what you were scheduled for."
Okay, so you were losing clients to the Baker Act essentially,
Yes, so I was losing clients
or
there, and
hours.
then I'm working at the clinic, and I'm thinking, I thought I was gonna be able to get, 40 hours, and then I started, getting happy if I can get to 30 or even 20 hours. But working two places, I'm like, between these two, I'm like, okay, I'm guaranteed I'm gonna get 40 hours, and you think you got 20 here and 20 there, and I'm working at the clinic, and a client doesn't come, and you're supposed to be with them for maybe 2 hours. Or
Mm.
let's just say sometimes where I worked, if maybe I'll schedule with one person, but then let's say another person, a client that has more higher needs needed, a session because they had a school. They had a lot of stuff going on there. They had a school, OT, PT, speech, diagnosing, they had a lot going on. So I just remember sometimes they're like, "Oh, well, we need you to cover this session for 15 or 30 minutes," even though I had another session that was supposed to be for 2 hours. So it's just like, so I'm about to lose hours because I have to work with this person for 15 to 30 minutes that I don't know, which is a whole other thing that's kind of,
Of course, yeah.
yeah, kind of frustrating. And then you're gonna give these hours to somebody else. Yeah, it was very weird. That lasted 3 months, I think, that I was there. And I remember, Shane is probably why I am where I am today with the group homes because I remember him saying, "Hey, I know you've had a lot of cancellations. We need to get you like some either early intervention or just some less intense clients." And he
Mm.
said, "You know what? We have this group home, and they need RBTs. We already have the BCBA or lead analyst. I forgot which term they used
Mhm, mhm.
because in Florida it's a little bit different here with our Medicaid. A lead analyst is not necessarily a BCBA. Sometimes it can be a licensed mental health counselor. I know my people in ABA are probably like cringing, but it's okay. It is what it is. So I just remember working there and developing a good relationship and just learning because there was still a BCBA as well that would come in sometimes just to oversee whoever was the lead person on the case. This person had two group homes, one right around the corner from each other. It was 6 kids in each, and maybe 4 out of 6 kids had ABA services. So you can
Mm.
imagine there was always plenty of hours to be worked and a lot of things that you could, work on. So let's just say a client was Baker Acted still. Okay, well, I have other clients I can work with, or if they didn't want to interact with you, or if they were feeling sick, there was always somebody else that you could work with in the house. And that was
Mm,
my first
gotcha.
introduction to a group home because I was scared. First, when they said a group home, I've only seen it on TV, and it wasn't represented in the best way possible. So I
Mm.
wasn't sure what it was going to look like. And it was just like any other house. You come in, there's kids there, there's, TV on the wall, there's beds in the room, there's food in the kitchen. The kids are interacting, but they just had some different needs. And I learned so much and I was kind of inspired. And that was actually when I was like, I said, one day I'm gonna have a group home. And I wrote that in my phone, and this was in 2017. I remember writing that in my phone saying, goals, have a group home.
Yeah.
I knew then though it was gonna be something that is expensive because honestly I was like, how do you save up or how do you qualify to get any
Where
money
to even
for
start?
this?
Yeah.
And that was just the beginning of it. So I actually ended up working there for a long time. It was easy for me to get my hours because I would work probably 40 hours, a week easily there.
Mm.
And sometimes, if I didn't come in during the week, I didn't mind coming in on Saturday mornings to work with them. It was a fun place
Hmm.
to be. And it's like, wow, work is fun. Like I'm here and I'm saying, man,
Nice.
I'm running their programs and I'm enjoying this. I'm like, this doesn't even feel like work.
Mm.
So I did that, and
Fantastic.
then I think actually I had my daughter, I remember, and I think that's when I started to really look at like, okay, I really do need to make some more money, and I was kind of close on my hours, so I was like, I really don't need to be here, full 40 hours. Maybe I can go. I thought I was going to go back to the school system for just a few months. I was like, I'm about to take this test. I'm gonna pass, and I'm gonna, be a BCBA and take on a caseload. I thought the BCBA exam was gonna be like the registered behavior technician exam. Even though I
Mm.
saw the questions, I kind of thought it was just gonna be kind of simple. I passed it on the first go, and I saw a lot of people taking the RBT multiple times. I'm like, this is kind of like all the stuff I learned in special education. Yeah, I was in the school system probably another 2 years trying to pass that exam because
Gosh.
it took me 6 times. I was just
Wow.
failing. And I was frustrated, but I was like, I can't quit, and because I just remember like if I quit this, and I had my daughter, I was like, man, how can I ever tell my daughter if she ever wants to quit something that no, you can't, you got to keep going through it, and I'm quitting on the thing that I actually made a big sacrifice because I was like, man, I could be a
Hmm.
assistant principal or principal by now if I would have just
Yeah,
stayed.
yeah, yeah.
So I pushed through and finally passed that exam February 20th of 2020. It's kind of like your birthday. I don't think you forget. So I remember I passed, and my goal was to stay the rest of, finish out the school year. I was like, maybe pick up a case or so here just to kind of learn. So I just didn't, jump fully into it.
Hmm.
And where I was working, one of the places I was also doing some working with as an RBT, they had a position, they had a huge need, of course, for BCBA, and they had found out that I passed. And I was like, I was planning on, staying, and also had another reason I wanted to stay. The school I was working at, we had reached a certain, level. Our grade went up because they do these grade levels,
Hmm.
A through F, and we had went up to a certain level, and there was money that was involved. If the school went up, you're supposed to get it. The
I
school
see.
system is very smart. You don't get that money until basically the end of the school year. So even though it was last year, yes, you got that grade. We're not going to give it to you until like May, and school ends in June. So it's March, and I'm just like, I was like, I don't want to leave, but we worked it out, and I was able to get the bonus in another way from from where I was going to leave early. And this is 2020, so that's that crazy period in time. I
Yeah.
remember I went with my wife. I took her to Cuba. So we went to Cuba, and I think we came back on a Friday. We didn't know what was going on because
Hmm.
over there, there's no national TV. The sports they're watching might have happened last month, and they're just now seeing it.
So
So
you
we
were
didn't know what
lucky to
was
get back.
we were. A Saturday, the airport's fully closed, and we're just kind of shocked because I'm like, oh my gosh, we were there Friday and the plane was really late, and I was getting nervous because if you ever been there, you have to turn in. They don't accept their money once you come back, I guess, in the airports.
Hmm.
They only accept US dollars, euros.
Hmm.
So I had their money, but I didn't have any US money, so I was
Hmm.
getting very nervous, and you can't use an ATM.
Gosh,
Yeah, so
yes.
so much was going through me. I'm like, man, I'm supposed to start this new job. I think like 5 days from now. I said we can't get stuck here. So we were able to
Hmm.
get back, and then I started so my new job. A couple of days later. And this is COVID. It's a different time period. The schools actually went out on spring break, and
Hmm.
they never came
You never
back.
came back. That's right. Yeah.
So during this time, I'm, learning, what it is to really be a BCBA, and I had a, great clinical director that I got to see 4 days out of the week. Yeah, I've known him for a long time. I mean, I just remember him always saying, he's like, Arthur, you don't have to be here forever. You can just, just need 4 clients. And I'm just like, I just got here. I just passed. I'm like, I mean, I know it, I know what a BCBA does, but I'm really trying to learn more, even though when you look at some of these larger corporations, they're not necessarily BCBA owned anyway. I said they just
Hmm.
have some strong clinicians behind them, and they're probably able to handle the money part better, but not the part that's actually bringing the money, actually working with the kids. So I listened to him say that for, I don't know, a few months. And I was like, let me just look into what he's talking about. So I just started looking around, and there was actually a webinar in September, and it was how to start your own ABA clinic.
Hmm.
And I remember one of the BCBAs that was hosting it, Nandy Nelson,
Hmm.
maybe it's Dr. Nandy Nelson actually now.
Yeah,
And
yeah.
I remember I attended,
Shout out.
and I was just kind of listening, and I'm like, man, this is a lot. I wasn't understanding some of the stuff with insurance and all these codes and hiring procedures. And I asked a question on the webinar. It didn't get answered, but somebody reached out to me. And I'm like, is this real? I'm
Hmm.
like, I don't know. Somebody said, well, I saw you ask this question. Maybe I can help you. And during this time, it's a lot of stuff going on in the world. So I'm like, is this person really who they say they are. So I looked them up and then I look up their company and they're based out of California. And the person reached out is still a friend, a mentor, coach today, Lakeisha Cobb Hayes.
Hmm.
And we started, working together. We met twice a month. And, it's supposed to be for a whole year. And I think we got to 9 months. And that kind of just, she's like, oh, this is everything. And during that time, I was actually working on different things. Like I had homework basically of stuff to do because in my head, I was just going to be there and wait till this was over, then get started. In our first session, she had some other business owners on there. And I said that comment and somebody said, what are you here for? We're here to execute. I was like, oh, so I need to hear that because I really wasn't ready. I was just trying to soak it all in and then just take all the information and do it all, which I'm so glad I didn't do that because you just don't do everything that's required to start a business, especially this field and the time that insurance takes to credential you. I mean, you need to start, before you want to open. So we went through this. I think May, that's when May is when I took on my first client. I met with a case management agency because I reached out to them and they said, well, we'll have you on with some caseworkers so you can talk about your business and what you're looking to do because we have a huge need for ABA services because I just knew, once I got this business going that the clients are just going to be there. I just put on Facebook and I'm just thinking, I know there's a huge need. I've seen the wait list. I hear about the wait list. And it didn't happen like that. Even on the call, I was fortunate that, I got my first client from that call. But and I was still working at the other place too at this time because I knew I just needed 4 clients before I could leave and feel comfortable to survive. So I didn't go full time until October 1st or 3rd, whatever the first Monday of October was. I remember going to FABA and I remember after FABA was over that Monday, I was full time and thinking that I learned so much because I'm thinking, okay, clients are just going to come. And it didn't happen like that. But I was fortunate enough to just go slow. You get one, then slow you get two. And I was trying to go slow as well because it was just me at the time. And I don't know if I didn't add RBT for a few months. So I was doing the direct services and
Right.
everything that was needed. But slowly over time, you just start adding people. And I already knew BCBAs and BCABAs. Luckily, just being in the field, our field is small.
Hmm.
Some people get word of what you're doing, and some people want to change, and they want to do something different. They buy into the mission, and that's my thing is always being mission driven. It never was about necessarily making, oh, I want to make X amount of dollars. Because honestly, for what I was doing, I didn't realize how low Medicaid rates were in Florida. I didn't know. I guess I had my blinders on and I didn't even know how to look it up. Now, fortunate enough, Cass, put that out there so you can see. And I knew before they put that out there that the rates were low, but now that I actually get to see all 50 states, I look back and I'm just like, how did we I don't know how we survived or what I was thinking, trying to just go after an underserved population to stay open, which I'm grateful for. I did that, but that was kind of interesting to see, like, wow, I was surviving with these low rates. And then I'm looking at Arizona, Georgia, and I'm just like, wow, your RBT reimbursement rate is about what I got as a BCBA.
Hmm.
So it's funny to look at that. And during that time, maybe the following year. So that was 2021. Business went very well. I
So
was
this is
very
this the North Florida Behavior
Florida Behavior
Consultants?
Consultants, yes.
Right.
So that was in 2021, and by 2022, that's when I started talking about, man, we should do a group home. And I remember thinking to myself, well, my wife can, she can handle like the group home stuff, and I'll do the ABA services to keep things, separate. So I'm like, I know the insurance that, the kids are gonna have. So I'm like, okay, that's a guaranteed, full house, 6 kids, and I'm like, okay, this is really going to work. So I remember we were able to get the house, purchase a house with some land because we want to build more. Very fortunate, know how, had a good realtor that kept looking and looking because I looked at a lot of houses. And honestly, we wanted to rent, never wanted to purchase a house. I just thought you could rent. But I'm in Florida and there's a lot of private equity that buy homes to rent. And also, when you mention the word you want to do a business, especially you said the word group home too, it's got a negative connotation for whatever reason for some people that don't understand
Mhm.
it.
Sure.
So couldn't rent, had to buy. Very fortunate. Business was doing well enough to be able to do something like that, which I could never have imagined, when I got into this field to be where I was to do something like that. So we go through this whole process of trying to open up this group home. Originally, we were doing this with somebody, and things didn't work out how we thought they were going to work out. So we ended up kind of having to, you know, part ways. And so, it's just me and my wife doing this. And I love my wife, and I'm just like, honestly, to see she was there some days, with, I don't know, we had four, maybe just four kids, and we were doing what we consider at risk. And they have a definition for it, and then I can give you the real definition, honestly, because at risk means they're in Florida, they're at risk of, human trafficking or being put into human trafficking.
Sure.
That's what the definition is. That is not what you would see. A lot of the kids we had were more so in danger of going to our Department of Juvenile Justice, or they had already came out of that population. So imagine a full house load of that. And that's not necessarily what we thought it was going to be. We really thought we were going to get some kids maybe with ADHD. We didn't think autism. That wasn't in our mind at the time because for who we were licensed through, I thought that you had to be another licensed home to have those kids.
Mm-hmm.
And then I kind of learned that it's not that easy to get on the med waiver and go into these homes. Some of these kids are in foster care. They're with another licensed agency until they can qualify, which can take a long time to qualify. They do get to kind of skip up a little bit when they are in foster care, but there's still wait lists. There's only so many homes for kids at that anyway for group homes. It's a lot more
Mm-hmm.
options for adults.
Sure.
So I remember we actually closed. We opened that group home up April of 2020. This is 2023 now. We opened up. By June, we closed. Was It was just a lot. It wasn't what we thought. So we closed, and I ran to a friend at a conference maybe a couple weeks later, and I told him what we had gone through. And I remember him saying he was like, "No, you got to open that back up." And I'm just like, in my head, I'm like, "Do you not just hear what I just said? Like all the stuff, I mean, I have."
I don't want to do that again.
Yeah, I got holes in doors that I didn't even know you can kick the hole in the door like that. And he said, well, if I knew he was working with the youth that he was working with the agency. He said, why don't you take kids with take our kids, that have autism or cognitive, delays. And I just sat there, looked at him for a second, and I was like, honestly, I didn't know we could. I said, I thought that this was, through another agency. And he was like, before they get to the other agency, they're here. And I said, it's not that easy. I started learning about how a lot of the kids that have autism, Down syndrome, or any kind of cognitive delays, or medical complexities, they're moved around so much, it's honestly hard for them to get the necessary testing that's needed to qualify for, a permanent home. The kind of homes that we have, we're licensed with our Department of Children and Families. It's a temporary thing. So your options when you're in the care of DCF is, of course, reunification, and you get to go back home, which is what they're always pushing for, or you're looking to go to a family member or relative, and they're always looking for that before they even, put you into a level of care like us. And then the other option, of course, is, you qualify to go to the med waiver, type of homes, which here in Florida would be agency for people with disabilities.
Mm.
So for us, we're licensed as a traditional home. We were at risk before, and then I learned that the kids that have autism or any kind of cognitive delays, even though they may have sometimes the same behaviors as kids that we had that were at risk, there's still at times minimum physical aggression,
Mm-hmm.
verbal aggression. They will never fall under at risk because of that diagnosis,
Mm.
which was interesting and something I was like, oh wow. So we we're traditional, so it's helped us out so much. And slowly some agencies know who we take, and then some still don't necessarily know about us. It's a hidden world, honestly.
Mm-hmm.
I tell people all the time, you still have to market in some manner, because if people don't know that you exist, how are they going to send
Right.
people to you?
Right.
Um, we've worked with a few agencies. I mean, I have my personal favorite. and they know who they are that we work with. But I remember, one thing I do like to do is outreach.
The second secret word is family.
So I remember when we reopened, I had the list of all the agencies that handled the placement, and I sent the email out to every single one of them. And I called, some picked up, some responded back, some didn't. But that's just kind of stuff you have to do because for us, when you're starting off, right now, the one service we offer is the residential care. And because of what I do, and just working in the field of ABA, I think it's kind of special compared to other homes is, ABA is kind of just built in to what we do, like our service plans. So when they ask about what service do you offer, I tell them, I say, hey, I train our staff. They're not necessarily RBTs. Every now and then we might have an RBT that happens to be on staff, but not everybody is. But, I train and, work with our staff so they know how to work with the kids, so our kids don't get, ABA based off insurance. I think unless it's court mandated, then I do look to my best to get them at least on a wait list because there's a wait list everywhere. So you're not just gonna. I always laugh when you see it, on a kid's stuff like, oh, they recommended ABA. I was like, you guys have no idea how hard it is to get services. And then you want to say that the child has Medicaid. There's so many people that won't even touch Medicaid. Some people honestly just can't credential with them, and some just choose not to because they say it's difficult. And then I look at all these other insurances, and I'm like, man, I like Medicaid. I'm afraid of TRICARE, the military insurance. I said I wouldn't touch them. I credentialed with them, but I wouldn't. I was scared to do anything with it. But that's just kind of our story of how we got into the group homes. And our goal over time is to build, I have a goal of 10 homes before I say we're over and done. And that's going to take time. And I'm fortunate I have, a coach that I work with that's helping me see a bigger picture of what our business can be, which is Strive Youth and Family Services. So, services with the S, like we need to offer like more than one. So one of the services we offer, I'm always able to say, oh, we offer ABA. But something else that I kind of realized I want to be able to offer other services in my area to other kids that maybe are in foster care or are considered, that at risk. So something I'm working on now that's going to take time is, adding that targeted case management piece. But I love having a coach because they're opening my eyes to what else can we do outside of just offering residential care, which is needed. That's a huge thing in itself, but there's other stuff that can be done. I think sometimes a lot of us don't look outside the box because if you don't have somebody else, looking over your shoulder or somebody that's a couple steps ahead to see the bigger picture, you don't know what's out there. I mean, something I'm even learning going down this group home route, I struggled to find a house to rent. And then going to certain conferences and having coaches, I've learned that there are healthcare real estate firms out there. Like they only want to work with people that want to do what I want to do. Some people will rent the house to you, outfit it as needed with your fire alarms, fire sprinklers, which is a huge cost, and then rent it to you. There's some that will, even build the home for you if you have the land, and then you can like, set it up, in the agreement, after 5 years that you have first rights to purchase that. I mean, of course, they're probably going to charge you more, but I mean, it's a business, so you kind of learn that, hey, this will help me. This helps out cash flow. I can save, so I know at 5 years I need to be able to either purchase it outright or have a mortgage to purchase this from them. So much stuff I've learned, and I'm grateful for the coaches and people I meet over time. Especially through LinkedIn, which is how I think we met too.
Yeah. Okay. There's a lot to unpack there, Arthur. That's quite the story. So I want to go back a little bit to your first introduction to group homes when you're with Shane Spiker and kind of all that sort of thing. Back then, were those group homes for autistic kids?
No, they weren't. Well, it was for some, maybe a couple had autism, and then some had some other behaviors, like sexual behaviors. So it's just interesting to see. And I don't even know if the kids that had those kind of the sexual behaviors, I don't even know if they even qualified for ABA through insurance. Florida is different, especially Florida Medicaid, I would say is different because most insurances, yes, you need to have an autism diagnosis. Florida Medicaid, which I'm grateful for, don't necessarily need to have an autism diagnosis. You can have almost anything on that DSM-5 that relates to affecting your way of life. So not necessarily can have a speech delay and qualify, but ADHD,
Hmm.
ADD. I've worked with kids. They had a video game addiction diagnosis,
Yep.
which I didn't know was a real thing until I
Wow.
remember getting placed on that kind of case. And I'm like, they qualified? And but then you're reading, okay, when you have an addiction like this, to see the behaviors behind it, it's just like, wow, okay. So I'm grateful. I don't know if Medicaid would ever cover that all the time, but I guess it depends on how the plan is written and the picture that you're showing whoever's reading the plan, because that's what it all comes down to with insurance. Like
Yeah.
you have to write a beautiful story so they can see what you're seeing through words, even though they can't, physically be there, which is
Hmm.
a whole nother story on its own on
Sure.
the words that you use for your service plans.
Yeah. Okay, so and so you kind of started your sort of dive into group homes back with Shane Spiker. Then kind of COVID hits. You start thinking about sort of, how am I going to make a living here? You find a workshop on kind of how to start your own ABA clinic with Dr. Nelson, and then from there you kind of start learning more. You connect with Lakeith Hayes, learning more about how to kind of start a business. You start North Florida Behavior Consultants with your wife, and then sort of from there, you're looking to kind of shift back into group homes, going back to the dream of the that you wrote in 2017 on your phone, kind of bringing it back to life 5-6 years later. You start working with kind of at-risk youth, which and I'm in Canada. I still struggle to understand all this insurance and waivers and Medicaid and all this kind of stuff. But I am learning more. As I start to interview more and more American folks, I start to understand, at least with the Medicaid piece, we're really talking about underserved youth. We're really talking about folks that are really in need of these services, and then their services kind of lacking for them. Often, folks are kind of at risk, whatever at risk happens to mean in the jurisdiction you're at. But in general, generally speaking, these folks are all at risk for, you know, um, uh, low qualities of life going forward without getting some kind of service, and certainly at risk for being institutionalized or regardless of the diagnosis. And so really kind of that kind of passion for kind of providing those sorts of services. I'd like to know a little bit about um, um, you haven't done this all on your own. It sounds like your wife's been, a major player throughout all this. I'd like to hear a little bit more about your wife and kind of what her expertise is, and kind of how she did you meet her in this kind of work, and
No,
kind of
no.
together start doing this? Like, how did she develop such an interest in this?
Oh, let's see, gosh, I met my wife. I was fortunate enough. I went to church on the right day and met her when I first moved here to originally to Jacksonville.
Yeah.
But the first business, gosh, if honestly, I don't think I probably would have sold if I would have had her involved. I always kept her somewhat on the paperwork just in case something ever happened to me. But
Mhm.
she's always asked, "Can I help?" And I was like, "No, I got this." And that's probably the biggest lesson I learned from the first business. And I knew doing the group home, I was like, I learned my lesson. I was like, no, I said, I do need help. And she's that operations part and keeping things organized, all that paperwork stuff that I don't like, that I struggle with. She's so good, and that's just her natural ability. That's just her operations. She's a planner. She writes everything down. That's
What's her
just her.
background?
Her background originally, teaching, and then for her master's is actually in ed leadership, but
Mm,
she didn't want to be a principal.
mm,
She knew from the beginning she wanted to go to the district levels.
mm,
Everybody else is getting their internships, going to schools. She got her internship at the district level, and
mm,
from there, she's like me. She made a connection, and that's how she was able to get her first job working at the district after she
mm,
graduated.
mm,
But that's just her background, work with operations, working with others to, I
mm.
guess, see the bigger picture.
Yeah.
And I remember when we closed, and I remember after talking with my friend, and I told him, I was like, yeah, I'm gonna have to talk to my wife. Yeah, let me see if we want to reopen. And I just remember going into her office here in the house, and I was kind of slow because I was like, man, I gotta say this eventually if we're gonna do this. So I remember slowly walking and trying to fumbling around my words, trying to get together. I was like, hey, I know things didn't work out. I know, doors were kicked in, kids were throwing rocks at me, and getting thicker acted. But I was like, I think things can be different this time. I said, I don't need you to be there at the house. I just need you to handle everything else, all the paperwork, all the stuff that it takes to open up, because everything that it took to open up, I didn't handle that. I mean, I know now somewhat how to do it just because I've seen her, but that was her, all the paperwork, because even going through relicensing, everything that's required, she handles that. Some people always ask me about consulting. I'm just like, it's a team effort. I said, I can tell you the codes from the city, what you're going to have to do, but paperwork wise, that's her. I see, and that's what I learned from the first thing. I was like, you can't do everything yourself. You need a strong team. And I kept hearing that, and I just remember how frustrated I was with the last business. And I was like, man, gosh, if I had her involved, I said maybe things would have been a little bit different. Maybe I would still be open. Maybe we had both things going on. So you live and you learn, and it goes a lot smoother. And I'm always thankful for her because I just remember her being at the house by herself sometimes 24, 40 hours, with the kids. I'm just like, my wife is not the person other, we have kids too, but just for the kids that we had, I'm just like, for me, I mean, I would have, all right, cool. I probably been fine, have been normal to me, but for her, that's not her background. So to see that, and I just remember telling her the first thing, like, hey, you don't have to be at the house. If anything happens, I'll be there. And every now for the kids we have now, she doesn't mind if she's ever had to cover a shift. For some reason, if I can't cover it, because the kids are different and their needs are they're manageable. It's nothing, don't have to worry necessarily about somebody coming after you trying to, hit you or come attack you. So that's gosh, without her, this business wouldn't be around, honestly. It's a lot, that paperwork part, because it's not just working with the staff and working with the kids. You don't have that stuff that the agency needs, or, you're not organized, you can be shut down and then, well, there goes the business.
So you said this is a temporary housing for youth, and that and so the are there like permanent group homes for children, or is that even a thing? I mean, I
Yes.
know for adults it makes sense because they're going to live there potentially the rest of their lives, but
There is permanent, so our here in Florida, agencies for people with disabilities, that's where your med waiver comes in. And the group homes for kids, which very few, I mean, very few, and they're just kind of speckled in places. But those would be your long term. So from birth to 18 is, where they would go. And a lot of times providers, not necessarily like your mom and pop kind of places, but your larger organizations that are doing this, they'll have it set up where, yes, they're coming to you 0 to 18 and they have a home for kids. Probably have 6 or 10 homes just for kids. But when those kids turn adults, assuming that they're not adopted, because that's still always going to be what they're pushing for, is to see if somebody will, adopt them prior to them turning 18. But if they're not adopted, they hit 18. The larger organizations, they just can easily transition them into a group home for adults. They probably already have some openings, or when you have money like that, I say you can just open, just go build a house knowing that, hey, I'm going to have X amount of kids and the need is there. We can just build this home for, yeah, this guy, but, we can have, more adults, coming that are kind of aging out. So they'll be your permanent housing, which for us, we thought about that. Um, it's two different things. It's two different licensing agencies. Because I remember when we opened, I thought, well, we're licensed with this one agency. I was like, I wonder if we can be like a dual license. And then I kind of found out that both agencies, their statutes don't align, and that's not possible to be dually licensed. You're either one or the other. I don't know why, because you're still, some stuff is the same. And then honestly, I think when I talk to people that do agency for people with disabilities, they say, oh, it's a lot easier. And I'm just like, I saw the requirements and I've seen the fines that come if certain things are not correct. I said, the upside is yes, you don't have to worry about somebody leaving. They're going to be there essentially if you're working with the adults into end of life, or
Mm.
kids, hey, until they turn 18. So that's the upside. But the other side is I've seen it's a lot of oversight that happens. With that oversight, fines can happen if something's not correct. Medication is not logged, something's not signed.
Mm.
It's not necessarily like that with the other agency. I'm still, on top of that, making sure things are correct, but it's a little bit refreshing, at least for now, that there's not a fine associated. And who knows, maybe after when this comes out, they'll implement something saying, well, this is not right, we're going to start fining you.
So how long do these kids stay with you?
For the kids that we have, I think the shortest is probably 8 months. I think right now we've had somebody for about a year and 1 month, and it's probably going to continue. I mean, it's kind of interesting when you're in care. If you don't have any family to go to,
Mm.
you kind of once you get into the a group home setting, especially for the kids we take, I'll say it's not going to be easy just to find an angel, that special person to take in a kid as
Mhm.
a foster parent because they always want the kids to go to a home like a foster home instead of being in group care. But for who we take in, that's just not reality. So for us, they are going to stay probably longer with us, because families or parents have, I think, up to a year. They have whatever the case management or the court says they have to do. They have a year to do certain things. So during this time, parents retain their rights no matter what's happened, unless they terminate rights, which makes it very interesting for us as a provider sometimes to get things done because our kids have individualized education plans. And I can just give you some examples of when it becomes interesting and hard to do the right thing. We have this IEP meeting and we don't have educational rights. Oh, the parent has educational rights. Okay, so parent might be in a facility, like maybe it's a drug rehab facility or something like that, or maybe they're even temporarily in jail. How do you schedule this meeting or ask these questions of, hey, can you hop on to this meeting
Right.
when they're in this kind of placement, but then from the school system is like, well, you don't have rights, so we can't have this meeting. And it makes it easier if the parents have the rights terminated, where they're still able to see the kids if they want to or if they're able to. But usually the agencies are able to get educational surrogates, another person that's deemed by the court to handle the rights for any education rights, which I wish I could, because I mean, when we go to these IEP meetings, I talk the language, I understand what they're saying, but I don't have the legal rights. And it's in the Florida statutes that,
Mm.
oh, because we're that provider, we can't also serve as the educational surrogate. And yeah, it kind of hurts because it's like so many things that I would do differently and some things that I've seen the school systems do that if those were my kids, I said, no, I already know X, Y, and Z would happen. I already know which person, which lawyer I would already gone to. This would have been fixed, but sometimes our kids get overlooked. I don't know if they do it on purpose, but
Is that just an effect of the temporary setup? Like if you were a permanent group home, would you have more ability to advocate and be involved or no?
oh, we still wouldn't have those educational rights.
Mm.
And that's a big thing, especially if you're working with kids. We're responsible, trying to make sure that they get the help they need in school. But federal rights, at least they're federal right now.
Mhm.
These federal rights that these kids have, it's only so much I can do to help them. And I can always, talk to educational surrogate and, the agencies that we work with. I mean, the person that handles that part, man, a beast. They are on it. If I ask, they're handling it and they know the laws backwards and forwards. It's just, I have to reach out to them and tell them. And it's like, it just be so much easier because I don't know a lot of things, but I actually do know this part, but I can't do this or I can't request certain things. It has to be, the educational surrogate or the parent, which is that's the interesting thing. So I think people don't realize, parents retain rights. I don't know how it is in other
Mhm.
states, but I do know here, at least in Florida, it's kind of hard to lose your rights, even though the kid
Mm.
might be in care. That is the last thing that they want to do is terminate a
Sure,
parent's
that makes
rights.
sense.
So they do. I don't know, people talk about Florida a lot, but honestly, when it comes to, foster care system, we actually do things pretty good, and some states kind of try to follow what Florida does. I know people talk about us, but at least like to put that out there that when it comes to this, we actually kind of lead the way in what they're doing in foster care and how they're trying to make these, community connections to help kids and find, parents
Yeah,
or find families to adopt or even temporarily take in the kids. But it
that's
kind of
great.
hurts that the kids don't, that the parents get to keep those rights because it hinders some things that we want to do. Because even with medication, same thing happens. If a parent still has rights, I've been very fortunate to have a good relationship because of North Florida behavior consultants to know people that handle things and can do, diagnosing. But what you say,
Mm.
a kid needs medicine to help sleep, if parent still has rights, I have to figure out that parent schedule to figure out, okay, how can they get on this call so they can be explained what this medicine is to help their kid,
Of course,
even though, that parent never even took the time to do
they're not
this
involved, but
themselves.
yeah,
Yeah, it's
yeah.
just always interesting. I said, we're so involved, and it's like I can't be as involved as I would like in some regards, but we make it work. We learn over time. I just know who to reach out to more directly
Yeah.
these days.
It's interesting. It sounds like so these permanent placements are few and far between. So the odds of sort of your kids ending up in one of those is probably pretty slim. And then, you know, uh, unless the courts decide or whatever, the family reunification is something that's going to happen. It also sounds like that's something that's pretty rare. I mean, I think generally speaking, in the foster care system, that's why these kids get stuck in the system for so long. So if you're a temporary placement, but is it possible that these kids are still going to be with you as if it were a long-term placement because there's nowhere for them
Yeah,
to go?
that's very possible. That's what we're kind of learning now, even though they're only supposed to be here for some amount of time. But usually, even then, when they whatever the paperwork they fill out, they'll put that this is a I won't say permanent placement, but they'll say long-term
Mm,
placement. Because I think when we first reopened, I think the first set of kids, we actually had a set of brothers that came to us. And you do all this paperwork to get them in school. And then I think we had a meeting on a Friday, 2 weeks later, a meeting on a Friday saying, hey, the judge says that they're able to go here because I think they had a sister. So they're able
mm,
to go. The judge says yes, this family can take the brothers in, then we'll let you know, and they'll just come here. And in my head, I'm just like, it's Friday. I said they're not. I said judge probably not going to answer this.
mm,
I think staff had called me like 9 o'clock at night, and if I get a call at night, I'm just kind of nervous. I'm just like, okay, what's going on? And saying, well, there's somebody at the door. I'm like, you mean somebody there? They're saying they're here for
mm,
so and so. And I think that's the first time that was the shortest stay, 2 weeks that they came, which was good. They were able to get back. It was just kind of that communication just wasn't there. But other than that, outside of them, long term, at least I think the shortest stay outside of them is about 8 months. And it could honestly be longer, because unification again, is the name that is the goal, and we kind of pride ourselves. I love data, so I do keep a list of the kids we take in and how long they stay, and where did they go, where they be reunified, where they would go to, APD, so far I've been able to see one that's a set that hey, they were able to be reunified. One I think was able to get that APD placement. We haven't had anybody yet to be adopted, but just even though we've only been open for a year and some months, just for who we take in, I say it's still kind of playing out. I don't know what it's going to look like,
mm,
but I'm always so happy and I like to share with my staff. Like I'm so thankful for them because I say,
mm,
hey, this
mm,
kid's been here X amount of days. I just start using this software so I can put in the dates, and then I can see like, oh wow, they've been in care for X amount of days. So when you see they've been in care for 366 days. I'm like, oh, that's a whole year. This is X amount of days. And then to know that they're with us because it didn't work out with just another family. It kind of means a lot to say, okay, hey, we're doing something different here. And I love that we have caseworkers. The kids have caseworkers where they're from, but then if they come from out of county, they call them like they get another caseworker basically.
Hmm.
That's kind of like a courtesy worker. But it always means a lot when I talk to them and they say, I love, how your staff is, you guys are really involved. And I say, that means a lot because that's our goal. And I know that doesn't happen necessarily at all group homes. And I say I'm probably more involved than I know some people like to start businesses and they always say I want to work myself out of a job. Yes, you do want to do that, but for me, it means a little bit more, and I'm so involved with this. I love it. I love working with the kids. I love seeing like what they have going on that I am probably more involved, but also it's good to see the staff working with them and then to hear in return from a caseworker, they don't have to tell me these things that, hey, now I was here today and, staff is doing XYZ. I love because they talk to the kids too. They talk to them private, and you never know what they're gonna say. Like, I
Hmm.
always get
Sure.
nervous because our first go around, I remember three of the kids when they got Baker acted. That was the last time with us. They said all kinds of things that were untrue, but I'm just like, wow. But because they said that, our Department of Children and Families, they still have to do their due diligence, look into this stuff, even though it's not true, just to, they have to do it. I get it. But so I get nervous every now and then when I hear like they were talking to them, like, okay, I'm hoping they ain't saying outrageous because you never know. I mean, kids have dealt with trauma, and for some, they can say anything, maybe because they want attention. And I always keep that in the back of my mind. Trauma comes out differently. Maybe they're having a bad day, but luckily, they haven't said anything. It's always been good. So it's good to hear back from the caseworker that, hey, you guys are doing a good job. I said, that's all I care about to hear because that means a lot. And I like to report that to the staff to keep them energized and know that
Yeah.
what they're doing matters because they might not see it on their end. But I'm like, you don't get it. There are some places out there and kids do not get taken care of how you guys are taking care of them because I mean, I tell them all the time the food that kids get to eat because we do have a menu that's approved and it doesn't say you have to cook the food a certain way. I said this is what they're eating today, but I mean they cook like for me, I think of, sometimes Sunday dinners might be the biggest meal I might eat. So I said for our kids, I said you guys basically get, that Sunday big dinner every day of the week. I said, I don't even think my own kids get this kind of meal that you guys get to eat. But it's good because our kids, where they come from, they don't get to, some of them don't know that they're going to have a meal every day. Sometimes they're coming from abusive situations where
Sure.
that's not a guarantee that,
Yeah.
oh, we get to eat every day. So now they're
Yeah.
kind of learning that, no, that's normal. We eat every day. We shower at least once a day, which is always interesting for some of my boys. I think
Hmm.
even using the bathroom is new. I think our one of our first clients when we reopened, he didn't use the bathroom the whole first day, and I kept getting nervous because it was just me there. I'm like, this is not natural. I said, he hasn't gone to the bathroom. And I'm like, it's been 24 hours. And I think we went someplace and then
Hmm.
on our way back, we get up the steps. And at the time, because he had these things, casts on both his feet, he was on his knees crawling. And he gets over before I'm trying to open the door, but then he kind of goes over. He pulls down his pants, just starts peeing outside. And I knew where he came from that they didn't have running water. So I said,
Hmm.
this is probably normal. So let him finish what he was doing, and I let him know. I said, hey, we have a bathroom here. He just looks at me. He's like, okay.
Wow. It's
And then
mind
after that,
blown.
yeah, and it was just like, I said, man, this is his first time being in a place that has running water. So for him, he didn't know, like, oh, you go to the bathroom, and that's cultural differences. I mean, some people talk about cultural differences, and I said it means so much more to kids that are, in the foster care system of what they've seen, what they dealt with, what's normal to them.
Yeah.
That's not normal to me, not to have running water. That's a necessity. So
Absolutely. Wow, that's scary. That's what I want to touch on. You've been talking a lot about your staff, and it sounds like you really value them, and are, and are really fortunate to have such a good group. What's staff retention like for you? Because I know in sort of adult services, certainly where I'm at, retaining group home staff is difficult.
ours is actually good.
Mm.
I think when I was doing ABA, I kind of was told if you can 2 years is kind of what you're doing good if you can keep somebody for 2 years.
Sure.
At 2 years, you shouldn't expect them to either stay or be in the same position. You want to move them up, or
Yeah.
they might just leave on their own.
Yeah.
So with this, our staff retention, I haven't, my wife probably, she could see all the dates, but I
The
say our
numbers.
staff
Yeah.
yeah, I remember when we closed, when we, reached out to people that we were reopening, everybody said, yes, we'll come back, which we didn't know because I know that they had dealt with some behaviors that we didn't expect. And most of them came back. We did hire on a few new people, but at least almost I would say 8 months to a year is what I kind of expect. If we can keep somebody for a year, that's great. And that's some have stayed for just about that long. Retention has been great because the goal for what we're doing, we operate on shifts, 8 hour mostly 8 hour shifts, and we have a morning shift that is a little bit like a 3 or 4 hour, and that's just to come in, help get the kids ready, get them on the bus. But some people operate on a parent model, or they might even do a 12-hour shift, which I usually see a 12-hour shift mostly for adults, but I did visit a place that operated on that model with kids, and I thought about doing that kind of parent model, or maybe we have the space if somebody wanted to stay
Mm-hmm.
there. That could be something they do. And I remember going to visit this place, and they said it works out good. But then they told me a situation. Unfortunately, they had like a husband and wife that were working, and they said, "Hey, well, unfortunately, the husband passed away." And then I was like, that just took that out of my head. I was like, nope, I can't do it. That's why I
Mm.
like to work with kids,
Mm.
because I'm assuming that we're taking great care of them, that, hey, they're going to through, live for a long time, so I don't have to worry about that. So I
Mm.
kind of just was, once I heard that in my head, I was like, I don't know how I feel about that. If I just
Yeah.
come to the house one day and somebody's, just not getting up. So I said, we'll stick with
Yeah.
this 8 hour shift. And it helps too. So we have probably more staff. I think we have, if I don't include me and my wife, 10, I believe right now. So, I think we have a few that are full time and some that are part time. But our goal as we grow is to, start offering, more, I guess, more benefits too as well, to our staff, and just some other
Mm.
things
Mm.
for them. Because I'm always trying to think like, what's something different, something that I want to do, something that I would want, or maybe someone else would want that they're not going to do this here. So I think we talk about staff retention. I started looking at organizational behavior management, something I've really been
Mm-hmm.
trying to get into. So I've been
Mm-hmm.
still looking at it from what's going on in the ABA world, but I'm
Mm.
paying attention to like, how do you keep that staff retention? And I'm seeing things about doing certain kinds of events. My wife is really big on us doing some kind of staff appreciation at least once a quarter. We do
Nice.
something. So the end of December, even though our football team is not doing good here, our local football team, the
Hmm.
Jaguars aren't doing good, which we didn't know this when I went ahead and just we got this for our staff and kids. We got a cabana for the game. But that's just something I said, if we were going to do this, I said, I want to do like an outing, something that is just like, thank you.
Yeah.
And I tell my staff all the time, and that's one of the things my wife always tells them, like, don't spend your money on the kids. Like, let us know what's needed. Wherever they
Mm.
need, we'll make sure they get it, or we'll make sure that we give you the money to go get it. Don't spend your own
Mm-hmm.
money. And our staff is just, they just get the kids stuff that they don't
Mm.
have to, stuff that we can certainly, afford to go get them or
Yeah.
reimburse. And they do some stuff we don't even know that they get it. I might just go to the house and I'll see they have something. I said, where'd you get this from? So and so got this for us. And I'll go to him. I was like, hey, why don't you let me know? I said, we can reimburse you for it. He's like, it's okay.
Mm.
It's just like they just want to give. And I don't think
Yeah.
everybody gets that from their staff. And I don't know how we're fortunate to have staff like that, because it's not something we
Awesome.
expect from them to be doing
Yeah.
this extra
Yeah.
stuff for them.
Yeah. Yeah. Oh, that's impressive. Starting a group home is a monumental task, and it sounds like you're doing a great job with plans to expand and grow. And I'm excited to see it. Kind of just looking to kind of wrap things up here. What else you got going on? We were talking before we hit record. You had the behavioral business blueprint podcast. You think about bringing that back?
I think about it. Sometimes I think maybe I can at least do a newsletter.
Yeah.
I started it with the goal, I just wanted to personally learn about other businesses in the behavioral health world to see
Mm,
what's going on there, how does it operate,
mm,
and honestly, is it something maybe I want to get into? So I
yeah.
really wanted to take a deep dive to understand. And then I just realized it was a lot. I got to, 10 episodes. I mean, I'm thankful for technology. It wasn't like the editing was hard. I mean, technology
Yeah.
took care of that
For
for me
sure. Yeah.
and even posting it. But then I had to ask myself, where was I going with this? Like, what
Yeah.
was, because I like to start, I realize this by myself. I like to start some things without a big picture plan of why am I doing this?
I get that.
And I was like, I couldn't think of a reason why am I doing this? Because it wasn't, especially when you do a podcast, it definitely wasn't something, monetary, to do this for. It was just for personal development. And then I just started getting, I guess with the group home, started getting busy because we're still working on our, I guess, we have our policies and procedures, but we're trying to get our standard operating procedures, making sure that those things are really kind of intact and to start paying more attention to what am I doing that I shouldn't be doing or what's something that I could kind of offload. So I started paying more attention to that. So that kind of just distracted me, but it also helped me once, I stopped doing the podcast. Then I started paying more attention to what are some things that I'm doing right now that we could, someone else could do. So, we're able to, promote one of our staff, to house manager to handle some of the things because
Mm,
our kids eat. I said,
mm,
we are constantly at a grocery store, for
mm,
us,
mm.
I don't know if you have in Canada, but it's called Sam's Club here. So we were constantly in there buying food, but that was something for me I would do, even though, I would order it online, I still had to take the time to order it, then go pick it up mark it because I have to put dates if it's not clearly on there. So, hey, this is the expiration dates. But I was
Mm,
doing
mm.
stuff like that was eating up time and some other small things, but I didn't realize, that was eating up some of my day that it shouldn't have doing the podcast. So that's when I kind of just stopped and having the
Yeah.
realization. So I don't know, maybe I'll get back to it. Or sometimes I think, oh, I can at least do the newsletter. But then I keep thinking, what am I trying to get from doing the newsletter?
Yeah. Yeah.
What's the bigger picture? So one of the bigger pictures that we're working on now is, targeted case management is something
Right.
we want to add on to what we do with Strive, because again, Strive Youth and Family Services. I'm like, we got an S on the end
Yeah.
of
There's
that. We
some
got to have
services. Yeah.
some services. So I think one of the lower hanging fruits to try to add on is that, and over time, I wanted to bring some stuff in house because our kids still require counseling. You have your med management because many of our kids take medicine. They have different needs, and some come to us, and yes, we know they have autism, but we have no paperwork necessarily that has the diagnosis written down. That's something that's needed. So sometimes we still have to take the kid back to get some of this paperwork, just say, hey, they have this. And I'm like, man, it'd be nice if we could just do that in house. Somebody could just, do this documentation, not only for our kids, but I'm like, just as another provider in the community, because it's very few people that want to work with Medicaid. And for us, that's just what we're trying to do, just trying to be another provider to help out where there's such a huge need.
Arthur, you're doing great work. You're doing great work for these kids. You're doing great work in the community. And I think excited to see where Strive is a year from now, 5 years from now. Excited to see your group home houses multiply on that land of yours and kind of really see what comes out of it. It's been really fascinating hearing about your journey and really appreciate coming on the podcast.
Thank you for having me. This is
Yeah,
good.
right on. If you enjoyed this discussion, check out these episodes for more conversations about supporting folks in out of home care. Episode 20, Consulting in Group Homes Using ACT with Monica Peters. Episode 40, Applications of Behavior Science to Foster Care, Runaways, the Homeless and Bullying with Dr. Kim Crosland. And episode 48, Group Homes for People with Intellectual Disabilities with Dr. Christine Bigby. If you enjoyed this episode, please consider leaving a review on Apple Podcasts, Spotify, or wherever you get your podcasts. And please follow us on Instagram @BehaviorSpeak.